Intake Processes to Address Racial Disparities in Early Intervention, a capstone project by Kathleen McCausland. It's not hard to find news stories and research articles discussing racial and socioeconomic disparities in the delivery of healthcare, social services, and education. Much has also been written about the complex reasons for some families to have decreased trust and engagement with medical and social service referrals. The research shows that this also impacts early intervention in terms of both numbers of referrals and levels of family enrollment. Early intervention sits squarely in the middle of referral sources and families, but recommendations for EI programs to address these specific issues seem to be absent from the literature. The early intervention intake appointment is a point of connection and involves sharing a lot of personal information, so this is a good opportunity to extend the conversation to issues of racial equity and trust. It has been important to work through the language of these talking points ahead of time and get to a place where it doesn't feel awkward. An essential aspect of my project has been building and working with a team of collaborators. Each meeting brought new perspectives and insights that really helped the work to evolve. The second aspect of my project was creating one-page, highly visual infographics that can be sent to families by email or text. The content of these materials was chosen in response to observations about the most common questions heard from parents in the intake appointment. I choose which infographic to send to each family based on their reason for referral. The final piece of my project is a short survey seeking feedback from families who are referred to early intervention but decline services. At the very least, it is hoped that reading the statements on the survey will serve as an acknowledgement of the complex feelings and circumstances that make home visits not feasible for the family at this time. As an intake coordinator, I am committed to making use of these materials with each new family I meet. I will continue data collection on all feedback and will periodically meet with my colleagues to analyze and revise the processes. In the future, I will again reach out to the larger early intervention community to share and collaborate on this work through meetings, conference presentations, and possibly publishing an article. My hope is to continually adjust and improve our efforts and support other programs to begin similar initiatives.